I was very honored to present our study looking at patients who had either renal cell carcinoma or melanoma and were on immune checkpoint inhibitors at the time of COVID-19 vaccination. So we looked at all of the patients between December of 2020 and April of 2021 at Duke who had either of those diseases, were on an immune checkpoint inhibitor as part of their therapy, and received a COVID-19 vaccination during that time. And we compared them to a control group of patients that were not on any systemic therapy at that time. So we wanted to look at a couple things. So we wanted to look at the safety of COVID-19 vaccination in patients that are on immunotherapy, as well as the rates of adverse events post-vaccination for those patients. So immune-related adverse events, as well as sort of any adverse events reported by patients. And then we looked at COVID-19 infection rates in those patients as well. And so we identified 74 patients on immunotherapy. Of those, about 20% reported any sort of adverse event. Important to note, most of these were mild, none resulted in any hospitalizations or any treatment interruptions. And then we identified about 12% of patients had a severe immune-related adverse event. So we defined that as any patient who had an immune-related adverse event serious enough to need systemic steroids, a treatment hold, or a hospital admission during COVID vaccination. And so it's important to note for both of these things. So for the immune-related adverse events, these are rates that are not higher than what we see in patients in clinical trials of immune checkpoint inhibitors not getting vaccinated. And then the rates of adverse events we saw in patients were lower than what are reported more rigorously in clinical trials of COVID vaccines. So collectively, this shows that in this, single center retrospective study, good evidence that COVID-19 vaccination in patients with cancer on immunotherapy is safe.